What you are being invited to begin now is known as a Feldenkrais Awareness Through Movement lesson. It's a beginning, an excerpt from a puzzle where you are invited to take unaccustomed notice of yourself and make unaccustomed, small, slow movements so that your brain and nervous system, your whole self, gets a chance to organize your loading of inner weights and your way of moving differently. It's a way of learning, like an infant's, which encourages more brain, less pain, more grace, and less pace.
Could you find a gentle way of getting down on the floor to lie on your back, with your legs outstretched if that is comfortable, or with one or both legs drawn up so that one or both feet are standing flat on the floor, if it is not comfortable to have them both long. Have both arms lying alongside your trunk, down towards the hips and thighs, palms down to the floor. You may need a paperback book or two placed under your head, yes, the occiput part of the head, but do not use a cushion or Chinese pillow. The support needs to be firm. Learning involves asking oneself questions sometimes about how do we know what we know. For example, now, with eyes closed and mouth slightly open, how do you know what parts of you are touching the floor? And what parts of you are not touching? How do you know which 3 or 4 places are pressing most heavily? Well, it's not by seeing, is it? Our present experiment has ruled that out. It's by feeling. Notice how much of your weight is in the legs, or if your legs are drawn up, how much is on your feet. How much pressure is there on the sacrum bone, that region below the belt line and between your 2 hips? Is the pressure there a little off-centre? How far? Leave it unbalanced. If your axle is twisted a bit, it probably needs to be, at least for now. Is your mouth still a bit open, jaw relaxed? You can breathe through your mouth or nose, but have the mouth at least slightly open. Let your attention go up your spine now, to the upper back and shoulder blade region. How much of your total body weight, in terms of how much pressure you're feeling there, do you feel there? 60%? 40? 20? What do you reckon? Is it off-centre? To which side? How much? Just note and remember without attempting to change. And let your attention now go up to your head. Are your eyes still lightly closed? Mouth still lightly open? Funny I should ask, but some of us tend to jam our jaw joints without noticing it. Just where do you feel the weight of your head pressing on the floor? How much does it feel as if it weighs?
If you can imagine going to the supermarket and buying 9 or 10 plastic tubs of butter, or a dozen or more half-pound slabs of butter, and feeling the weight of them, that's about how much your head weighs, and probably more.
Without opening your eyes, You may be able to feel that your nose is not pointing straight up to the ceiling, but a little bit to the left or right. At any time, if your back is uncomfortable, draw up your legs so that your feet are standing. Without moving, can you compare ear to shoulder distances? Is your left ear closer to your left shoulder than the right is to your right shoulder? Or vice versa? Mouth a little open. Can you imagine listening to a soldier ant marching along your shirt from collar to shoulder tip? I mention a soldier ant, figuring they probably stomp along more noisily than the other kind and are easier to hear. Listen. Is there a difference in the listening, left and right?
Like a good truck driver, you've now checked your load, feet to head. Wait a minute. Could it be that one foot is angled differently to the other? Check that out, if you will. Different camber? Different caster? Never mind, they're close enough. They have travelled a lot of miles that way already. Have the brakes locked again? That is the jaw jammed shut? Might have to watch that one.
Almost ready to go, like a Victor Borge concert, we are ready to check the steering. As you lie there with your mouth a little bit open, where is the tongue? Where is the tongue tip? What is it touching? A little to right of centre? A little to left? And the lips. On which side are they closer together? Is that the same side the tongue is pointing to? If you can imagine a movement so small, maybe an eighth of an inch, 2 or 3 millimetres, a movement of the jaw so slow an observer wouldn't notice you're doing it, and then do such a movement, you may find that it's easier to move the jaw to one side than the other. We may sometimes find that our jaw joints up near the ear become our tension regulators, the brakes we apply at the skull-face junction. They may become not only too tight, but uneven. Could you check that out in the following way? Begin with the mouth a little open. Then, slowly, begin to close it. At the first contact, stop. That is when a top tooth first makes a light contact with the bottom tooth. Hold that first contact position, but keep breathing easily, and stay there till you've identified which is the side of first contact. Then complete the closing. Notice the fit. Notice any underlap or overlap. Perfect fit or bent scissors. Will you now gently review what you found from feet to head to jaw by small, slow movement? How the feet point and what that does to each knee and hip joint? Then draw up one leg so that the knee is bent and the foot is standing flat on the floor. Then the other. Notice which one you moved first. Notice again now the sacrum axle in the middle of the pelvis, and how it may be easier to roll just a little to one side by pushing a little with one foot, then the other. And as you shift your weight slightly at the sacrum, does it reveal a gap under the low back? A gap a little bigger on one side than the other again, suggesting some twisting of the lumbar vertebrae. And as you continue this minute rolling, settling first one hip slightly, more firmly towards the floor, and then releasing, how does this affect the upper back? And how does it affect where the chest is pointing? Which shoulder is more relaxed, more supported, closer to the floor? Have you ever noticed a baby lying like this, in full relaxation, with both shoulders lying flat on the floor? Stop moving. Again, notice the occiput, that back and base of the head, and how it's pressing the floor, and exactly where. And with mouth a little open, like a baby, begin the tiniest nodding movement you can do without interfering with the easy flow of your breath. Keeping the attention just above the collar and up to about the hairline, you may notice left and right a small wrinkling and tightening of the skin, and that it's a little bit different each side.
You're attending now to the area where the two tiny rockers of the occiput,
Got it.
called condyles, sit on the top neck bone atlas. If you make a half fist and look at your hand, the knuckles of your first two fingers will give you a rough idea of their shape. When we are upright and holding our head up, we're performing a great balancing trick. As you nod slowly now, those rockers are sliding in two shallow dishes called lateral masses of atlas. Each is about half as wide as a teaspoon. The whole atlas bone that they are part of is about as big as a slightly squashed matchbox, with a 20-cent sized hole through the middle of it, and weighs about 2 ounces, 50 to 60 grams, and balancing on it, and about 60 times its weight, is the head.
As you become more observant with this tiny nodding, provided your mouth is a little bit open, you may notice it is reflected in a tiny increase and decrease in the space between upper and lower teeth. Soft lips coming a little closer, then going a little further apart. Even the roof of the mouth and top of the inside of the throat. Can you locate that? There too there's an ebb and flow, in time with the nodding. Let the movement go now. Rest, and give yourself some credit for what you do every day.
Balancing an 8-pound ball of head on 2 little rockers, in 2 little dishes, on a hollowed-out matchbox, on 23 other sliding bones, all stacked on an axle called sacrum, joining 2 tilting hips, on complex moving supports called legs, and moving from one set of 26 bones called foot to the other as we walk. No wonder it's tiring to be vertical and restful to be horizontal.
Would you now gently review what you found out about your loading from sacrum to occiput? Again, where are the 3 or 4 places that press most heavily? If they are off-centre, are they all on one side? If not, which ones list you to the left, and which ones list you to the right? How do your feet point? Or if you've drawn your legs up, knees bent and feet standing, which foot is closer to the buttocks? If your legs are still lying flat on the floor, notice again the gap under your lower back. And bend and draw up slowly one leg so that the foot is standing. Which leg did you choose to draw up? Now gently draw up the other so that both feet are standing and are about the width apart of your hips. What has that done to the gap under the small of your back? Can you again identify the pressure point between your 2 hips, the sacrum? Identify exactly where that is. It may not be the centre of your body, but put it in your memory as your centre for now, your centre of gravity of the pelvis for now. Imagine you're a dressmaker or a tailor, and you know exactly where to mark that pressure point with tailor's chalk. Move a little to make sure you have the exact place by pushing with your right foot so that the right hip lifts just a little and the left presses a little closer to the floor. Then slowly release that push so that the right hip comes back to where it was and your sacral pressure point is right back on the imaginary tailor's chalk mark. Now do the same on the other side, softly pushing the left foot to slightly raise the left hip so that the right hip is pressing a little more heavily. Where has the pressure point moved to now? Then slowly release that push so the left hip comes back to where it was and your sacral pressure point is back on the imaginary tailor's chalk mark. Your mouth open, jaw relaxed, and eyes closed, breathing easily. Keep the pushing going and see if you can notice any movement in your head. It's a much smaller movement there, but we have much greater sensitivity. Encourage the head to move in time with your hips. Not as much as the hips, but starting and finishing when they do. And when you've done that a few times, can you do the contrary? As you push the hips to roll across the sacrum towards the left, can you gently let your head roll to the right? Let that go, and again resume having them both in time. Does that feel a bit more natural now, a bit more graceful? As you do that, can you let your attention go back to the upper throat, the uppermost part? Does it know about this small side-to-side sway of the head, coming from so far away from the hips? Does that upper throat have any tiny movements of its own, little adjustments of tissue tension? Can you increase these tiny upper throat movements while keeping the hips rolling and the head in time with it? And pretend for a moment that those upper throat movements are driving the head, driving the chest, driving the sacrum. Let all movement go. Let your legs one at a time go long and rest. Again, notice your contact with the floor, your 3 or 4 main pressure points. Have they changed? Is there a sense of being more flat, more pressure points, a more even distribution of your load? In your own time, find an easy way up to standing and test out your standing and walking. Though this recording was commissioned initially as one of a series for a specialised professional audience, we hope the experiment on it may have yielded you some useful information about this. You to seek out other teachers and other lessons. Good luck, good self-knowing.